Welcome to the video in which we want to show special teachers working in inclusive education how they can support pupils with spina bifida and hydrocephalus. I am Teresia Drdulová, a special teacher, and I am supervisor and mother of an adult son with spina bifida and hydrocephalus. The process of inclusion presupposes the belief that people with disabilities also have dignity and value and have something to contribute to the good of society as a whole. If we want to strive for the successful inclusion of pupils with disabilities, we cannot just focus on good academic results. We take a holistic view of the learner and aim to support their autonomy and functionality in their natural environment now and in the future. This assumes that in getting to know the pupil, in addition to asking how the limits of the diagnosis can be overcome, we also ask questions focused on the pupil's abilities and aptitudes. What innate abilities does the pupil have? What of his talents or character traits could be developed to a level that matches his aptitudes? Which innate abilities of the pupil manifested in his early childhood have been suppressed or silenced by cultural DNA? How and with what can I show this child that I respect his innate abilities? What will I say to them in the next 24 hours to show that I appreciate and admire these abilities? If we want to give children and young people the support they need, it is important to be sensitive to their needs, but also to ask for their views and opinions. How do the young people themselves see their place in school with spina bifida and hydrocephalus?
We come to school to learn how to communicate, to function in everyday life, to understand others, and to live with peers.
We are not at school just to cover as much knowledge as possible.
We are first and foremost disciples, though obviously different in some ways.
Some of our individual needs are different, but we all have the same rights.
We should have the same opportunities to choose, participate, and try everything as our other classmates.
Despite the fact that we are the persons with disabilities, we have our abilities and gifts.
We can enrich the people around us with them.
It will help us if we compare us only to ourselves.
We have our own unique individual needs because of our diagnosis, so it is unfair to compare us with those who are not affected by disability.
Our limits are obvious.
Encouraging us not to be afraid to ask for help will help.
Some of us may have difficulty fitting in.
We need support in forming and maintaining relationships with other people and appreciation for our progress, however small. Please listen to our opinion and perspective.
Together, we can identify the barriers that can prevent us from better participating in our society.
It will help if we experience respect for our uniqueness and acceptance of our abilities and limits.
Let us make mistakes and learn from them.
We consider the understanding of spina bifida and hydrocephalus to be the basis for effective special educational support for children and pupils with spina bifida and hydrocephalus. Which abilities and skills are directly limited by this diagnosis, and which skills, although connected by the diagnosis, can be developed with the right approach. The special teacher should objectify their beliefs about the student with spina bifida and hydrocephalus, their possibilities and their future. If you have not yet had experience with a pupil with the spina bifida and hydrocephalus, we recommend contacting more experienced professionals or an organization that brings people together with the following diagnosis. In the Malti in General Guidelines, as well as in Malti in Manual for Teachers and School Psychologists, we go into more detail about the specifics of children's development, as well as the possible impact of diagnosis on the development of subcognitive and executive functions. Pupils with spina bifida and hydrocephalus may have different learning difficulties, but their intellectual abilities are in the average range, with verbal abilities predominating. These pupils may have more pronounced impairments in spatial perception, executive functions, and mathematical abilities. So, what specifically can you do to give pupils with spina bifida and or hydrocephalus the support they need? As a special teacher, you have a great responsibility to be a source of objective information about the student in your workplace, knowing not only his diagnosis but also his personality or family context. It is up to you to be the advocate in the school environment for his or her rights through comprehensive development. One of the most meaningful areas of support for a pupil with the spina bifida and hydrocephalus is the finding ways for them to participate in school and community life. When pupils are encouraged from school age to take responsibility for what is happening around them, they are likely more to carry this skill into adulthood and not just become passive recipients of help. The past years of coping with the coronavirus pandemic have given us an insight into the situation of many people with disabilities. During these years, we have had the opportunity to experience firsthand the isolation, the fears about health and insecurity as we look to the future and the impact of these experiences on our daily survival. Children and pupils with disabilities have lived in this reality similar to the one we have experienced since they were very young. It is incumbent upon us as professionals to take this reality into account when planning our interventions. In the Multi-In Manual for Special Teachers, we therefore address the topic of promoting mental well-being in detail. You will find particular tips on how this topic can be effectively addressed in cooperation with pupils, but also within the whole multidisciplinary team. In the framework of individual work with a pupil with spina bifida and hydrocephalus, it is necessary to pay attention to the mapping of the level of executive functions and their development, in addition to the support of partial cognitive functions. According to the conclusions of this research, it is the executive functions that are directly related not only with academic achievements, but also with the quality of social skills, mental well-being, and overall quality of life. In the Multi-In Manual for Special Teachers, we offer basic insight into the issue of executive functions, but also a demonstration of practical approaches on how executive functions can be developed. There are also links to further resources and recommended reading on the subject. It is of considerable importance to focus attention on your professional to build the pupil's life skills. Promoting social skills leading to respect for authority, promoting self-esteem and self-respect. At the same time, it is desirable to foster the ability to accept one's limits and to ask for help. At an older school age, it is good to focus on developing habits such as proactivity, the ability to set priorities, perception and respect for diversity of opinion, ability to articulate a vision, and concern for the common good. In addition to individual work with the pupil, the role of the special teacher within the multidisciplinary team is very varied. Multiple professionals are involved in the inclusion of a pupil with spina bifida and hydrocephalus and institutions. It is much easier for the pupil and their family if a culture of mutual information, aligned goals of care, and mutual support is set up right from the start. A special teacher can become a leader of a multidisciplinary team by advocating for both a pro-inclusive philosophy and direction for the team. They can be the one who, by their understanding of the benefits of mutual cooperation, will motivate the other members by their example, way of working, and form of communication. The role of the special teacher is indispensable in the process of creating, fulfilling the goals and ongoing evaluation of the individualized education program. It should reflect the holistic perception of the pupil by the teachers, the knowledge of the pupil's specificities with spina bifida or hydrocephalus, and provide effective support for the pupil and for all those who contribute to its objectives. A good individualized education program should never be a formal document, but a dynamic instrument for change. We offer you a few questions that can help you greatly in developing a good individualized education program for a pupil with spina bifida and hydrocephalus. How specifically are the pupil's needs and any difficulties accepted? How often is the pupil given a safe space to express their views and needs? When and how is the pupil involved in the process of planning and evaluating education? When is the pupil provided with space to socialize and form relationships with peers and classmates? Which extracurriculum activities does the pupil participate in? When and how does the pupil have the opportunity to develop their hobbies and pursue their preferred activities in the school environment? Is the pupil provided with the place and sufficient space to carry out personal hygiene? Do all teachers respect the pupil's extended toileting time? What percentage of all areas of the school are accessible to the pupil? What kind of equipment and technical solutions are needed to ensure better accessibility of the environment, pupil mobility, or to achieve the set goals? For which activities it is necessary to provide the necessary level of assistance? Through a well-designed individualized education program, the special teacher can provide and coordinate support for the pupil, teachers, assistants. Specifically through interventions, environmental modification, consultation with specialists, and curriculum adaptation, thus fulfilling its special education mission. The Multi-In Manual for Special Teachers aims to be a guide, advisor, and mirror for special teachers working in inclusive education, according to which it can adjust its action to perceive the abilities of children and pupils from an early age. They look positively upon them and set their professional views and attitudes towards children and pupils with spina bifida and hydrocephalus.
Let me thank everyone who cares about making the lives of people with spina bifida and hydrocephalus more beautiful, more worthwhile, so that they can apply their skills and abilities and join our ranks.